Good afternoon. My name is Lisa Henderson, and I am going to be presenting the hand hygiene key performance indicator for my unit and the technology presentation for week 1. As healthcare providers, we are potential carriers of infection. Compliance with hand hygiene is one effective strategy to reduce hospital-acquired infections. Reducing hospital-acquired infections supports our organization's 2019 strategic goal of zero patient harm. This key performance indicator shows us the results of 2018 hand hygiene compliance initiative. Secret monitors were assigned to a unit and to our unit, and random surveys were completed to capture hand hygiene compliance. Data was tracked over the past 6 months here, and we can see that in June, we had about a 90% compliance rate. In July, we stayed about the same. August, we did dip down to about 88%, and September was our lowest at 85%. However, we did recover in October and November, and December, we finished the year out at a high of 99.4%. We have an overall compliance for the year 2018 of 90% here, 90.1%. And our organizational goal is 100%. So in 2019, we'll be looking to increase this dashboard even further. We'll begin with our October, November, December, and then in January 2019, we're looking to get closer and closer to 100%. Hand hygiene compliance is further broken down here by shift, revealing our evening shift at 90%, and our nights to be about equal at 90.2%. We also have data down here showing us compliance by encounter type. This helps us to look closer at key performing behaviors associated with compliance. We can see that after patient care, we have about a 90% compliance rate, or for an average in 2018. And then before patient care, we have an 89.3% compliance rate. But between patient care and semi-private rooms, we have our highest at 96%. This data will help us to identify potential barriers to compliance and further education needs as we continue to improve our hand hygiene compliance. This data here shows us that we have, this breaks it down further by staff role. Here we can see where our greater areas of opportunity are by specific role. You can see the number of events that were monitored in this column, and you can see the number of successes in this column broken down per staff role. And then in this column here, the number of percent of compliance gives you the compliance comparing the successes versus number of events. So for example, we can see here that our attendings, we had 77 monitor events. We had 63 successes of overall hand hygiene compliance. And then we have an overall rate of 82% compliance. We have some areas of opportunity in some of our low numbers, but you can see too that there were low number of events monitored. So in 2019, we will work on improving the number of events so that we can get a more accurate account for our success rate or our compliance rate. So increasing our number of random monitoring will help us get in a better idea of where we need to further educate, further support. We would also like to look further into the use of sanitizer, hand sanitizer versus actual washing, and then perhaps even break down our isolation precautions, looking deeper into our compliance with contact precautions and droplet precautions, etc. We can see here that we have some opportunities. We have our graduate nurse rate here. We've only got 2 events, so we'll increase the numbers of those, but we can improve. We have LPN versus RN, and then also our respiratory therapists here. We have a little bit of opportunity for improvement in both numbers. We had 381 RN monitoring events with a compliance of number of successes of 352%, so that 352 successes, so that's pretty good there. Hand hygiene compliance is a key performing indicator, which is part of our organizational strategy to reduce infections to meet our zero patient harm goal. As healthcare providers, we can be carriers of various infections and diseases, and hand hygiene has been proven to be the number one defense that we have in transporting and spreading the infections among our patients. Decreasing hospital-acquired conditions, specifically infections such as C. diff, will help our organization to obtain higher financial reimbursements, providing reallocation of those finances to areas of quality improvement that may be needed. Monitoring also shows us what areas are doing well, and it provides evidence on where we should focus our efforts to further improve our quality of care. Overall, we have made great strides in our hand hygiene compliance towards our goal. As you can see, we ended the year once again at a high note, so congratulations. Let's keep up the good work and continue our improvement. Thank you for watching this presentation.